Honorable Chief Minister, then Mr. Vallabh Kakadia, Mr. Asit Vora, Mr. Rajesh Kishore, my friend Kiran and Raghu. I came to this city about 3.5 years ago with the desire to build a large hospital. And I had the privilege of meeting Honorable Chief Minister and asked him to give us some land. And a few days later, I got a call to see a land which is about 25 acres of beautiful land near Gandhinagar. And I told the Chief Minister that we want to build a hospital near a place where poor people live. And Gandhinagar is not the place where we want to build. So please give us alternative land. And everyone was surprised that all the private hospitals are looking for land in places where rich people live. And here is an eccentric coming from Bangalore wanting to build a hospital for poor people. Yes, this is the reason why we came here. And we were given a beautiful piece of property which is about 37 acres. And we got the possession of land in exactly 1.5 months. We are looking for land in different parts of the country and nowhere it happened in that speed. And the credit should go entirely to our Honorable Chief Minister. Sir, I would call you a magician. You have made many things what we thought is not possible. We are grateful to many people in the policy-making body like several ministers and the bureaucrats who have supported us very, very strongly, and this dream of ours came true. A friend of mine, Abhay Jain, who was instrumental in helping us in the initial stages, unfortunately he is not here. I'm very, very grateful to him. Kiran, I'm glad you could take time off and come here, flying all the way from Dhaka. We believe that India will become the first country in the world to dissociate healthcare from affluence. We will have a very interesting scenario. 10 years down the line, we will still have millions and millions of people living in slum with no amenities. But when they are unwell, they will have access to high-tech healthcare with dignity. Why India can do it when other countries are struggling? Because we are privileged to be in a country which produces the largest number of doctors, nurses and medical technicians in the world. We are privileged to be living in a country which has the largest number of US FDA approved drug manufacturing units. Our only problem is our poor people do not have the cash money to pay for the healthcare. How do we address this problem? And we believe it is possible if we change the way the healthcare is delivered. In what way Narayan Hrudayalaya Health City here is different than the other hospitals of Ahmedabad or other hospitals of the country? First of all, this hospital is part of a 5,000 bed health city which will come up within the next 5 to 7 years. We are going to have a medical school, and I expect Honorable Chief Minister to inaugurate the medical school in less than 2 years. And this medical school will be primarily catering to the children coming from rural Gujarat. We want to build a medical school for poor children. In this hospital, there is an outpatient program for general outpatients, and the fee for the outpatient is just 10 rupees. This is the 10 rupees is the amount which patients are used to pay in a government hospital, and this is the money we are going to charge. We have a dream. We want every person living in Ahmedabad, if he ever requires a dialysis and he can't afford it, he should be in a position to have the dialysis. We want to build a very large dialysis center in this campus. We are recognized as a group which does the heart operation. Very few people know that our group performs the largest number of dialysis in India. how is it possible to get the cost of dialysis done to 500 rupees? It is possible provided every resident of Ahmedabad, when they are celebrating their birthday or wedding anniversary, kindly send us 400 rupees. When you are happy and celebrating, just send us 400 rupees. With that money, we will be able to do one dialysis for one deserving patient. Your contribution will help immensely to make Ahmedabad as the first city in India where everyone can afford dialysis. Around 5 years ago, we launched a scheme in West Bengal called Udayapati. Our intention is to get 2,000 children from villages of West Bengal to join medical college every year. How we did it? We identified bright children from villages of West Bengal. When they are 13-year-old, they should commit to us that they will become doctors. Then we give them a scholarship of 500 rupees per month and we mentor them. We tell them what it is to be a doctor, and these children work very hard and they crack the joint entrance exam and they get into any of the medical college, and we organize a student loan for them. Our desire is to have a similar program to get at least few thousand children from villages of Gujarat to join the medical college. All these dreams of offering healthcare to the common man will not happen unless government changes its strategy towards the healthcare. We have the Honorable Chief Minister here, who is the main policy maker for Gujarat, and in the near future we pray to God that he will be the policy maker for the whole country. And when that happens, I would like him to understand that one of the main reason why healthcare is so expensive is because when you build a 5-star hotel to cater to the rich people, 25% of the construction cost goes to the government as in the form of various taxes. That is acceptable. But when we build a hospital for a poor man, 25% of the construction cost again goes to the government. When a pharmaceutical company makes a tablet, 25% of the cost of making the tablet goes to the government in the form of various taxes. Sir, when you are in a position to change these policies, we would like you to think that unless the government walks the extra mile, private entrepreneurship cannot deliver what they are expected to do. We believe that, as I said in the beginning, we can show to the world that we don't need to be a rich country to offer healthcare to the citizens. All we have to do is private enterprise and the government should come together to make a difference to the people who are underprivileged. And we are grateful to the government of Gujarat for giving us this opportunity to be here, and we hope to see you again within the next 2 years to start a medical school. Thank you very much, sir.